Directed towards Ms. Wilkin. Sorry, Wilkin. I was just wondering, what is your plan on healthcare for the city of Vaughan?
Well, in regards to healthcare, I mean, I do know that there is the hospital proposed, and though that is a provincial issue, the NDP has a very strong healthcare platform when it comes to providing a doctor for every Canadian family. We would also, of course, support any sort of publicly funded healthcare system, any publicly funded health or hospital. Sorry, and as long as it had no sort of private what's the word I'm looking for? Incentive. And we definitely would support anything that would reduce the wait times that, of course, occurs at all hospitals. And we want to make sure that Canadians get the best health care when it comes especially to pharmacare. So any sort of prescriptions, we really want to look forward to the future of health care, to make sure that Medicare stays where it is, to ensure that prescriptions can actually be part of the healthcare system as well.
Thank you, and we'll do reverse order. So, Mr. Visentin, you're up first for 1 minute.
Thank you. Well, the tax shifting is a very valuable tool because it allows us to tax pollution and give money where we think it's missing. And federal money towards hospitals is on our agenda, especially devoted to long-term care and home care. And also, we do plan on increasing our old age supplement by 25% because, frankly, our seniors are suffering too much. And but once again, I have to mention that the Green Party will focus extensively on preventative health measures, improving the health of Canadians, lowering disease rates from some of the highest in the world and we're going to I think we'll be shocked, actually, at what we can do. And I think it's critical to show leadership in that area because our healthcare system, our publicly funded healthcare system, is at financial risk if we don't take that approach. And the Green Party, of all the four parties here, is the only party that I know of taking a very aggressive approach that way. Thank you.
Excellent question on healthcare. As you know, in Vaughan, we have no healthcare, and that is something that has to change. While Mr. Bevilacqua was the MP here in Vaughan, he absolutely advocated for no health care here whatsoever. As far as what we're talking about is implementing the $41 billion 10-year plan to transfer more health care dollars to the provinces. We signed guarantee wait time agreements with the provinces. We have downloaded and offered money to the provinces for cervical cancer vaccinations to all provinces. But here, the central issue in Vaughan is we have no health care. And Mr. Bevilacqua washed his hands of the issue on a 2006 community meeting that I had when he stated publicly that health care was not his issue. And I still remember that. I still remember that.
I actually remember that meeting as well, and I obviously misunderstood what I was saying because I was very clear. As chair of the Finance Committee, as well as the Minister of State for Finance, responsible for making the recommendations that went into successive Liberal budgets, including increasing the transfer to the provinces to the tune of $41 billion. See, I've always believed that you've got to grow the economic pie so that you can, in fact, give a bigger slice to the provinces in the billions of dollars. And you need to just talk to former Minister of Finance Sarbar, and he will tell you that I fought for greater funding for the province of Ontario so that they could actually have the money to build the hospital in Vaughan. That is my role and responsibility. As well, doctors and nurses fund, catastrophic drug program, as well as investing a great deal in students so that we'll have more doctors for this country and indeed for this community.
And 30 seconds, final say.
I just think it's really integral that we hold on to the healthcare system that we have. We're known for having one of the best healthcare systems, having a publicly funded healthcare system. All you have to do is look across the border into the States to see how much a private sector healthcare system does not work. And right now there's an influx of this private pressure to make our healthcare system a private sector, and I think we really need to fight as hard as we can to keep Medicare and to put pharmacare as well onto the healthcare system.